So scuba diving is one of the more fun recreational sports you can do when you're on vacation. I've done it a number of times and it's always an amazing experience. The thing about scuba diving that you need to be aware of, though, is that you are not in your own environment anymore, and some very bad things can happen. And while you're out there swimming around, enjoying the three-dimensional space of the ocean and getting a better view than most people will ever get of the ocean, you are in danger of having some very bad things happen to you. As a critical care specialist, you need to know what these risks are and what the complications of scuba diving are so that you can deal with patients when they present. If you live in a landlocked environment such as Alberta, you're not going to see this as often, but there are some circumstances actually where you can see scuba diving related complications. So to start, you need to know two fundamental gas laws, Boyles Law and Henrys Law. Now, Boyles' law is the relationship of pressure and volume at a constant temperature, such that when you take a volume of gas at a set pressure, say 1 atmosphere, and then pressurize the gas, the volume of the gas will change proportional to the pressure changes as well. So at higher pressures, the volume contracts, at lower pressures, the volume expands. And that's Boyles' law. Henrys' law is the amount of gas that can be dissolved in a liquid is directly proportional to its partial pressure of the gas. So this is the thing you see this is the effect you see when you open a can of pop. The little small head of gas inside the bottle is higher pressure, and as soon as you release that pressure, the carbon dioxide in the fluid comes out of solution. Now, Boyles' law is responsible for the consequences of Barrow trauma and air emboli, whereas Henrys' law is much more responsible for the issues of decompression sickness and nitrogen narcosis. So Barrow trauma is probably the most common injury you're going to see associated with scuba diving. It can occur both with overpressurization and underpressurization, while most people only usually associate Barrow trauma with the overpressurization. But consider when somebody is at the surface of the water and begin their descent, they take a volume of air, and as they go under increasing pressure, the volume of that gas starts to contract. Now, if the air is in a relatively confined space, such as in the sinus cavities or the ears, it can actually cause a suction effect, which creates venous engorgement and mucosal edema, and sometimes even hemorrhaging. This will then create problems for the diver, because now they're going to have trouble at the lower depths being able to equalize the pressure in their sinus cavity. And then ultimately, once they start to ascend, they may not be able to equalize that pressure as they're ascending, and then can get into more trouble with overpressurization, Barrow trauma. But probably the more important and most concerning Barrow trauma is the overpressurization. This occurs when you're at depth and you're diving, and the gas volume that you have contained, and you start to rise, the gas starts to expand. When it's inside fixed spaces, the gas has nowhere to go, and it can cause significant tissue disruption and even rupture of tissue planes and also and blood vessels. Areas that are specifically prone to overpressurization Barrow trauma are those that are gas-filled. So the lungs are particularly prone to developing overpressurization Barrow trauma. And then this can lead to problems with air escaping into the mediastinum, pleural space. It can cause arterial gas emboli. And then you can also start to see, especially if somebody's had problems with underpressurization Barrow trauma in the ears of the sinus cavities, they can actually get an overexpansion, overpressurization Barrow trauma as they start to ascend, and that can cause injury and pain at that point. Very rarely somebody will also complain of dental pain associated with their ascent, and this is often because they have some gas trapped in their dental enamel because of tooth decay that is now overpressurizing and causing pressure pain. Now, again, probably not something you're going to see a lot of, but it's an interesting thing if you notice it. Decompression sickness is probably the more famous of all of the diving and scuba related complications. You see this when somebody is diving below 33 feet or 10 meters, which is about 1 atmosphere of water pressure. Below that one atmosphere of water pressure, you start to then have problems with increasing gas dissolving into the fluid plane. This is one of the reasons why resort divers don't let the divers go below 10 meters, because decompression sickness is not an issue when you're at those depths. Now, while technically there is probably a little bit more gas dissolving into the tissue even at those pressures, it's not significant enough to cause problems, even in the case of a rapid ascent. So now, if you take a diver who goes below 1 atmosphere, below 10 meters, they're now starting to dissolve more and more gas into their tissue. And the vast majority of this gas is nitrogen, because that's the majority of the gas that we breathe in on every day. If you then suddenly rise to the surface, Henry's Law says all of this gas comes out of solution, starts to form bubbles, and then also under the influence of Boyles Law starts to expand. And you're in many respects the same as a bottle of Coke with a lid popped off. Gas comes out of solution and starts to bubble up. Now, these gas bubbles can cause all host of troubles because they will cause pain locally if they come out of solution in, say, joints, where they cause the bends and the pain in joint pain and back pain. But the gas bubbles can also escape into the arterial system and block blood vessels. It can cause rupture of tissue, and then also, just by virtue of precipitating, can actually activate the inflammatory system. Obviously, people who have a right-to-left shunt are at much more risk of decompression sickness, because the gas bubbles can escape across the right side and bypass the pulmonary vascular filter, and then start to get into the arterial side and cause problems with ischemia in arterial areas in the brain and the heart and the guts. As well, and also relevant for all of us, because although we may not live in an area where we're going to see a lot of divers, anybody who's then subsequently traveled by air are at much higher risk for developing decompression sickness when they're flying, because they've gone from a high pressure environment to a normal pressure environment to suddenly a low pressure environment, and that can cause further precipitation of any gas that may be slowly coming out of solution, may accelerate that process and actually cause the bends. So it would not be uncommon for you to get a call from a patient who just recently arrived from the Caribbean or from Mexico, and if you get a further history, you may find that they just went diving and then hopped on a plane. Now, they should be warned not to do that, and most do know not to do that. On average, you need to wait about 2 days from your last dive until you can start safely flying again. But there are people who will do crazy things, and you may from time to time see these people. Decompression sickness can be divided into 2 different types. Type 1 decompression sickness is usually fairly mild and affects mostly the musculoskeletal and skin and lymphatic system. The MSK effects of decompression sickness is what we call the bends, where you get joint pain as a result of gas precipitating in the joint spaces itself, and this usually occurs within an hour after ascent, and so is usually the cause of the joint pain is usually fairly clear. As air bubbles start to precipitate in the skin, you can get a severe pruritus, but this also usually resolves spontaneously within about an hour or so. More rarely, you can start to see lymphadenopathy and edema as air bubbles start to get into the lymphatic system and can cause lymphatic obstruction. But this is not as common, and certainly takes a little bit longer to come on, but will also respond spontaneously. So type 2 decompression sickness is the more severe form of decompression sickness. This is the one that leads to death and disability. The air bubbles are larger, they're getting into more places, they're causing a lot more troubles. In general, you break this up into those problems that occur as a result of air emboli in the CNS system, and then air emboli that occur in the cardiovascular system and the respiratory system, leading to a certain number of different conditions. air emboli in the spinal cord, either in the anterior spinal artery or in the CSF itself, can lead to spinal cord injury and sudden paralysis. You can get cerebral venous obstruction, leading to what it would essentially be a venous thrombosis, sinus thrombosis, and then also microvascular air emboli leading to ischemic stroke. In the cardiovascular system, you get venous gas emboli that go to the lungs, leads to the typical presentation of pulmonary embolism with chest pain, dyspnea, and right heart failure. And then if there's evidence or the development of a right to left shunt, you can get paradoxical air emboli as a result of this. And on top of all of this, because of the air burden that is occurring, these people are also at high risk for developing acute lung injury as well as systemic inflammatory response. So the treatment of choice for decompression sickness is hyperbaric oxygen. In the time it takes to get somebody to a hyperbaric chamber, though, there's a number of things that you should do. First and foremost, you should provide a lot of extra oxygen. This in itself will at least provide some gradient for nitrogen diffusion to try to encourage this nitrogen to clear the system as quickly as possible. As well, if there's evidence of an air embolism, what you should do is get them into left lateral position with a mild Trendelenburg in order to keep the air trapped in the right atrium if at all possible. But hyperbaric therapy is probably, or is the best treatment for decompression sickness. Now, in addition to utilizing Henry's law of keeping this gas from coming out of solution too fast, it also utilizes Boyles' law by taking that gas which is already formed into bubbles and under high pressure, shrinking it down so that they cause a lot less trouble. As well, the high levels of oxygen under high pressure also provide additional oxygenation to the hypoxic tissue that may be suffering the consequences of the nitrogen bubble air embolisms. And then lastly, by providing 100% high pressure oxygen, you're also creating a much higher gradient for nitrogen diffusion so that the nitrogen that's in the bubbles dissolves quickly back into the plasma and then gets into the lungs where it can be excreted a lot more efficiently and a lot faster so that once it's out of the system, it can't cause you any further problems. The last complication of diving that I want to talk about is nitrogen narcosis. Now, this only occurs really with extreme divers, and it only occurs as a result of the raised partial pressure of nitrogen in the cerebral tissue once the diver is below 100 feet or 3 atmospheres. So the vast majority of divers don't go to those depths, and so it's much less of an issue for them. And for those divers who are knowingly going down below 100 feet, the tanks will often contain 100% oxygen, so they're not actually breathing any nitrogen in. And we'll try to actually wash the nitrogen that they already have in their system out prior to the dive. The symptoms of nitrogen narcosis are very similar to alcohol intoxication. They may start to have hallucinations and delusions, become confused and disorientated, much like they would if they had been drinking. A loss of consciousness can occur, especially when somebody is diving below 300 feet or under 9 atmospheres because of the high pressures of the high amount of nitrogen in the system. Fortunately, the most important and best treatment for nitrogen narcosis is to simply start ascending. This recovers spontaneously during the ascent and is generally not a problem once the diver is above 3 atmospheres. But the most important risk of nitrogen narcosis is the disorientation and confusion that can ultimately lead to a drowning. So that's all there is for today. If you have any questions or comments, please feel free to leave them in the comment section below or just contact me.